more understanding when we are discussing on this dispensing section. See, after all, any substance that is inert in nature, that can absorb the quality of the medicine, and that can be used as vehicle, basically.
Carrier.
So fundamentally we have to know that. So the ideal vehicles that were discussed, that were identified right from Hahnemann's time, has been, one is ethanol or pure ethanol or pure ethyl alcohol, and for preparation, and for the solid substances it was the milk sugar or purified milk sugar or the saccharum lactis. So subsequently, as the application of medicine is more convenient with cane sugar, these were the inert substances that were identified as the ideal vehicles for dispensing. The advantage and the limitation of water as a media is, water is not a good preservative, because water itself can get spoiled. Hence, see, we have to basically understand this.
Exactly.
Why various modes of vehicles have come into existence, right? Because these things retain the quality of the thing, quality of the medication. It can help in further processing, and it can also retain it for a longer period of time. I think this is what I wanted to add up.
Exactly. Thank you, Dr. Ramdas. So, in this, as you all have seen, there are different methods where people use to dispense the homeopathic medicines. So, most of it, what we can understand is, one is the doctor comfort zone, and how easily the patients, they will be able to accept it. Because where we are touching both the rural and the urban patients. Now, my question to Dr. B.T. Rudresh is, have you found any difficulty in dispensing these homeopathic medicines to the urban sector or the rural sector? Or was there any necessity for you to change the mode of dispensing the homeopathic medicines for these two sectors?
Certainly yes. You see, the urban sector have total faith in homeopathy, so that he has come to you.
Correct.
He will take whatever you give, however you give, whatever the form you give, it makes no difference as far as the urban sector is concerned, basically. But for him also, he will be more happy if he can carry it in his pocket and take it in the office in the afternoon after his lunch, or in the night if he wants to take, where he is traveling. So on that basis, he would be more happy to have it in the, either on a globule, medicine dispensed in globules in a vial. He would be more happy to carry it. And I have seen most of the doctors, most of the patients, however, outside, whenever I have met in some of the occasions, they said, I am also taking homeopathic medicine. When I ask them, they coolly open their small vial of pill. See, they open and they take in front of you. We have seen that. So carrying becomes more easy as far as the urban sector is concerned. That's why they want it in globules and as well as the diskette form. But they don't mind taking the medicines whatever the form you give, because they know that doctor is the best man to decide. We will take whatever he gives. But when it comes to the rural sector, they always feel that, as it is white. Most of the times it is odorless except the alcohol smell. Nothing else is coming out, and there are no colors, and nothing is there. And for cold also you give the same white globules. For cancer also you give same white globules. You take 3 days history, then also you give the same one. You take 1 minute history, you give the same thing. For him it is more of some jugglery is going on in his mind. What is these doctors are up to? So I think at the psychological levels, for his comfort zone, I would rather prefer to give it in a tablet form, which he is more used to.
To the rural sector.
To the rural sector, to make him aware that I am taking some medicines. It is only to making him to understand. And of course, it is as not compromising with homeopathic principles of dispensing. If you can able to dispense it through the diskettes to the rural side, he is more happy. He will be much more happy if you can give it in a bottle, in a, what is the mother tinctures. He would be much more happy if you can give it in a mother tincture. 2-3 bottles, 2-3 different colors, 2-3, he would be much more happier. But you can make him more happier by giving just diskettes. I am very comfortable with them. But one thing which I must say is diskettes which I have seen is more comfortable both in urban sector and the rural sector. Urban sector will take whatever you give. We are giving it to making more comfortable in carrying and chewing or whatever it is, so that we are giving it in the diskettes. The rural side is more, the size, shape, the quantity, everything matters to him. It really makes a sense to him as far as his apprehension and comprehension are concerned. So, if you want to cater both, I think I feel the diskettes would be more ideal to me. This is what I have seen.
Thank you, Dr. Rudresh. Now, before we go forward, I would like to ask the audience if they would like to throw any light on this. We have had quite a big discussion about what are the methods in which the homeopathic medicines have been dispensed to the patients.
I also would like to ask if some of the audience can throw light whether what we are trying to do or what we are already doing or what we are intent to do, is it on the homeopathic line of thinking, or is it on the lines of homeopathic prescribing norms, or is it at the level of homeopathic understanding of dispensing medicines? Will it fit the frame? That's all I want to, and if some of the audience can be able to come out with.
Dr. Ashok.
Dr. Ashok Dantakale. Yes.
Sir, I am of the opinion that since we also work in government hospital, sir, that we have seen in our hospital that we write one dose and the multiplicity of medicine is given and only one form of uniform form of prescription is given, that we give in the dilutions, the pills. But in my private practice, I have seen that, giving the Saclac powder. Saclac powder is also one of the effective methods of thing. The patient demands that you give in the powder form rather than giving in the dilution form or in the pills form. Because they are not uniformly charged up. So that happens, I think. So there is one more advantage.
Okay.
But in that case, my question is, when you take a dilution, when you suppose you have taken Natromur 1 m or you have taken Aconite 1 m, when you are putting that dilution into this sugar of milk or the globules or the diskettes, how does it matter? If Dr. Ramdas can highlight upon that. How does it matter if I take 1 gram dilution is there, Natromur 1 m, if I put few drops into the, whether dispersing or succussing or giving some more
directly on sugar of milk or on globules?
How does it matter? Or should there be a mattering point when you dispense it, a dilution is been taken in the clinic, put it into the either to the globules or to the diskettes or to the sugar of milk?
Sugar of milk.
Will there be any, are we violating any norms, number one? And I just would like to know.
I don't think there is any problem in either.